Good morning, everyone. It's a little after 11, so I think we can go ahead and get started. My name is Geraldine de Avila. I'm covering for Scott today as he's taking some well-deserved time off. Just wanted to thank you, everyone, for being here for this COVID-19 and RSV media briefing. On the docket today is Health Officer Kevin Dick, who's going to be giving an update on COVID-19 and RSV. And also joining us is David Wiest, Executive Secretary from the Nevada State Board of Pharmacy, who will be providing some recommendations on medication shortages. So with that, I'll go ahead and pass it on to you, Kevin. Go ahead and get started whenever you're ready.
All right. Thank you, Yara. And first of all, I hope everyone had a safe and healthy holiday. And we've got some good news as we head into the new year. That is that our overall trends for COVID, flu, and RSV seem to be trending down. And so we're seeing reduced numbers of cases from all of those diseases. I'll begin with COVID-19. Our 7-day moving average for new cases per day is 43. That's compared to 50 last week, and it was 57 the week before that. So COVID cases coming down. And we're also seeing that in the wastewater sampling data that's showing a decrease in the concentrations of COVID-19 detected. So this is good news. It's consistent with what we're seeing with our cases that are reported decreasing, as well as those wastewater concentrations decreasing. We know we have many more cases than that because we have so much at-home testing that's occurring for COVID-19. But the trend is significant, looking at both the wastewater and our reported cases moving downward. So for hospitalizations, the Nevada Hospital Association is reporting 42 confirmed and suspected COVID-19 hospitalizations, and that's a slight decrease from last week when it was 50. For flu, our influenza-like illness has been decreasing in Washoe County over the past few weeks. It was down to 3.1% of the cases that were seen by our sentinel providers the week that ended December 17th. That was down from 3.8% the week before. But we've seen a pretty good early season surge in cases that we're now coming down from. And our hospitalizations to date for flu are significantly higher than we've seen in the past few years. We have 220 hospitalizations so far this flu season through December 17th, or about 44.34 people hospitalized per 100,000 population in Washoe County. Moving on to RSV, we're reporting 151 new RSV cases in Washoe County from December 19th through the 25th. So that is a decrease from 263 cases that we were seeing just a few weeks ago. So we've had a steady decline over the past few weeks from that 263 cases per week down to 151 cases per week now. That brings our total to 1,554 cases so far this flu season. So that's a huge number of RSV cases that we have seen. We had a higher than normal number of RSV cases last year for the flu season that was just under 1,100 cases. So having exceeded 1,500 cases so far is a very significant RSV season that we're experiencing. But we're pleased to see that those numbers are declining. So in the past 3 weeks, the decline that we've seen has been from 53 RSV cases that were reported per 100,000 people in our briefing a couple of weeks ago, down to 36.2 cases per 100,000 that we have this week. Now, the state average is 13.17 cases per 100,000, much lower than what we're seeing. When we did our briefing a couple of weeks ago, we reported that Washoe County was much higher than the rest of the state. We remain higher, but what we've seen in that time frame has been a significant increase in RSV cases occurring in Carson City as well. So they rose to about our levels of cases, and we're seeing their numbers are declining currently as well. So that's good news for our region. As far as hospitalizations, even though RSV cases are going down, there's still high pressure on our hospital pediatric units, not just with RSV, but with other respiratory illnesses circulating in our community. So I want to remind people to work with your pediatricians if your children are sick, to try to have your medical assistance provided by your pediatrician, and avoid going to the emergency department unless your child is seriously ill and experiencing breathing difficulties, to try to keep the pressure off the emergency departments and the hospitals. Overall, our COVID, flu, and RSV trends are going in the right direction, but we have just gone through the winter holiday season. People that have been gathering with family and friends, and with vacation travel. And I think we've all seen the pictures of large numbers of people stuck in the airports in close proximity to one another because of the travel woes experienced with all the bad weather across the country. So we would not be surprised at all, and really expect to see some increase in cases occurring after the holiday gatherings, and with the number of travelers that were together in those close quarters in the airports. So we'll watch that as we move forward. And it's important to remember the importance of getting vaccinated, both for flu and for COVID-19. The bivalent booster is available for COVID-19. Only about 40% of our 65 and older population has received the bivalent booster, whereas about 92% of that population has been vaccinated with the initial series of the COVID-19 vaccine. So it's really important, particularly if you're in an older age group, to get the COVID bivalent vaccine if you haven't done so already, and also to get your flu shots, as we still have the flu season running through the first 20 weeks of next year. So with that, I'd like to pass it over to David Wiest, Executive Secretary of the Nevada State Board of Pharmacy, to talk about medication shortages and some recommendations for parents. Thank you for being with us here today, David.
Thanks, Kevin. I appreciate it, and I do appreciate a chance to talk to you. And I apologize because I typically attempt to do video on this call, but I'm having some technical issues today. So I'll just go with the audio, but if somebody wants to reach out to me after the fact, I'll happy to do some video outside of that. So I think it's just important that I get the information across. And so there's really two kinds of shortages, drug shortages, that we experience. The first is just a temporary or a localized shortage, where a pharmacy or some licensee doesn't order enough medication to address the needs of the patients that come in and see them. That's not the type of shortage. That shortage can be resolved with talking to your doctor about a different pharmacy, or talking to the pharmacy about a different pharmacy. That's not the shortage that I'm here to talk about today. I think this is the more pressing shortages that we've seen, and I've really seen two recently. The first one being the over-the-counter cold remedies for children, and then we've also seen some antibiotic shortages and medications for children short for the prescription drugs. And so for both of those, I think that the important thing is communication between the patient or the patient's parent or caregiver with the pharmacist or the doctor. And then when it relates to the prescription drugs, there's many times alternate therapies that can be prescribed. The physician may not know that there's a shortage, or your prescriber may not know. So just communication to them. The prescriptions can be modified by law, state law, without having to go back to the practitioner. So many of these can be resolved with talking to the pharmacist. When we get to, I think the more troubling one right now that we're experiencing is the over-the-counter cold remedies, Tylenol and Advil and those things. That is, of course, a national and kind of a worldwide shortage. And it's really related to the fact that we're, as Kevin was talking, that we're seeing more illness, and there just wasn't enough medication made to do that. The manufacturers are trying to ramp that up, but there's just not enough medication out there. And so the three things that I'd like to advise the parents on those products are that please don't hoard the products. I know it's tempting to hoard the products, but we need everybody to have access. So I don't think that it's good that we're hoarding any products. They can expire and go unused. And on top of that, there might be somebody else that has immediate need for them. Secondarily, we advise the patients or the parents to not attempt to use adult strength medication on the children. That can be dangerous. Sometimes the temperature and the pain is transient, and the long-term effects of the too much drug can, stay with the child for their whole life. Certainly in talking to the pharmacist and the doctor, other products may be used, but we just advise the parents not to just assume that they can take a quarter of a human dose, an adult dose, and give that to the child. And then back to what I already said, many times there's alternative to other products, and so communication with the practitioner or the pharmacist would be the thing that we would advise people to do, because there might be another med that could be utilized in the circumstances. And then I'll leave, happy to answer any question, but I'll leave probably with what Kevin said originally is, some of the things we're experiencing, there's vaccinations for, and it's never too late to get vaccinated. And so if you're concerned about illness, talk to your healthcare provider about getting vaccinated. And with that, I can answer any questions.
Thank you, Dave, and thank you, Kevin, for the update. We'll open up the floor now for any questions for our speakers. Also available for questions is Lisa Lautritz, Division Director for Community and Clinical Health Services, and Dr. Nancy Dow, Division Director for Epidemiology and Public Health Preparedness.
Hey, this is Lucia Starbuck with KUNR, and just to making sure I understand you correctly, Kevin, that COVID and flu cases are decreasing, and do you know why?
Well, Lucia, you did understand me correctly. They are decreasing. And as far as why, I don't know that I can give you a good answer other than we had a pretty significant early surge. So we were at pretty high levels. And fortunately, we're seeing those decrease. It could be due to people recognizing that we were having high levels and taking some more precautions. But I can't tell you specifically why they're going down. It's good news that they are.
I guess I'm surprised, considering we're kind of coming out of. I guess Thanksgiving was a while ago. I guess would you attribute that surge to Thanksgiving? The early one you mentioned?
I think we did see some increase here, and I know across the country, increase in cases following Thanksgiving. But I also think it's important to remember too that we have, as far as COVID in particular, a high vaccination level or immunity level that we have in our community. Because of people either having the vaccine immunity or being exposed from having the disease or both. So in many cases with those people that have pretty good immunity, their COVID cases resolve fairly quickly, and they may not be transmitting as much because of the immunity that they have when they do get the disease. So, but as I said, we need to be cautious looking forward, because we're just through the Christmas and Hanukkah and other holidays, winter holiday seasons. And so we have the gatherings, we have the travel, and we have, unfortunately, all those people that were stuck in airports.
Got it. Thank you. And this is the question for the other speaker. If you go to the grocery store and you cannot find any kids' medicine, you've gone to several grocery stores, I guess what should you do? Are there any home remedies you guys are recommending at this time?
So yeah, Dave Weist, thanks for the question. I think the one thing that people should realize is when we get to these shortages, some pharmacies do pull the product back behind the counter. So you should always check in with the pharmacist. They might have a policy that you can only buy so much. So it goes back to communication with the pharmacist. And then as far as home remedies, all the things we got when we were children, some may work for us and some may not, but those are conversations that you should have with your caregivers, either the pharmacist or your child's pediatrician.
Thanks, Dave. And then just a follow-up, and I don't know if you can answer this, but do you know like why this shortage is happening, or is it just simply just the demand?
Yeah, I mean, and it's out there, and we work very closely with the FDA on drugs. I'm going to preface it by the board's jurisdiction is not directly over the counter products. We do the prescription products, but many of our licensees carry them, so we're certainly aware of them and want to get the information out to the public. The shortage is directly related to the demand. And if you look at what the FDA is saying, there's no knowledge right now that there's been any wrongdoing in not one country keeping it, or we're keeping it, or anything like that. It's kind of a global problem right now, and the manufacturers just don't produce enough right now for the surge that we're having.
Do you have an idea of when things might level out?
I looked for that exact question in writing from the FDA or the CDC prior to this, and I could not get any documentation on that, and I apologize. I would have liked to shown up and said that it's going to end at this particular time. To further answer that question, I did talk to pharmacies in preparation for this and make sure that product are still coming in. So I talked to several pharmacies to see if they're still getting product. They still get product. The issue that they're having is they don't know when they're getting it and when they're not. So for the pharmacies, the product's just showing up when it shows up, and then there's still quite a high demand for it.
Got it. Thank you.
Hey there, this is Faith Evans with Channel 2. David, I think that a lot of people, especially when we have these shortages, kind of get in the mindset of, I'll just tough it out without medication. Even during these shortages, and especially if children are involved, can you talk about the importance of knowing when it is appropriate to seek over-the-counter care?
Yeah, I think it's a great question. Thanks, Faith. I think that it kind of goes beyond that. So I think that parents should realize that we have very good testing and rapid testing for whether it's RSV or the flu or COVID. And so I think that they should seek out testing if they're concerned for their child. Knowing what the disease is would help the practitioner kind of make decisions off what the best care is. And so again, I would leave that to between the practitioner and the caregiver. But I think that they should always have a conversation with their pediatricians. I think the pediatricians want the conversation, and there's testing that can help determine if the temperature or the pain syndrome or whatever needs care. And then on top of that, the practitioner could probably say this is the appropriate care.
Thank you very much.
Hey, this is Lucia Starbuck again. This is a question for Kevin. With flu and COVID cases decreasing, are RSV cases decreasing as well, or are those remaining pretty steady?
No, we are seeing a significant decrease in the RSV cases, Lucia. We are reporting 151 new RSV cases for the week December 19th through the 25th. And let's see, it was 3 weeks ago that we were reporting a number of 263 for the week. So there's a significant decline that we're seeing in the RSV cases. So we're glad to see that, but we're still at high levels historically because of the really huge number of cases we've had so far this season. But we're moving in the right direction, and we'll take that, and we'll hope to continue to see those cases decrease. One of the things that's working in our favor right now, I think, is school break that's happening. So at least we're breaking that transmission right now over the next couple of weeks of kids being in school together.
Thank you.
Okay, are there any other questions? Okay, hearing none, just a quick reminder that this briefing was being recorded and will be available on our website at covid19washoe.com, or you can also reach out to me directly if you need the raw file, or if you have any follow-up questions. We'll be happy to answer those for you. My email is ydeavila@washoecounty.gov. All right, thank you everyone, and Happy New Year.
Thanks everybody. Thank you, David.